AHOPE started nearly a decade ago as a hospice when Ethiopia was severely affected by the HIV/AIDS pandemic. The growing number of HIV-positive orphans needed a place to go where someone could comfort them and care for them before they passed away. Today, because of the availability of antiretroviral treatment, AHOPE has evolved into an orphanage and a community outreach organization. In our homes, we care for HIV-positive children who are destitute and have no one else to care for them. For those who have folks to care for them, we work to keep them at home and help them daily at our Child Development Center. AHOPE also provides home-based care to HIV-positive children and their families who live outside the city. Our challenge now is to teach our teenagers the skills they need for life as young adults as they prepare to leave AHOPE and live on their own. Our current objective is to obtain funding to expand our successful programs to a larger population and to purchase the land we need to make our homes and community center permanent. We hope to serve the community by keeping more HIV-positive children with their families, to effectively prepare our teenagers for adulthood, and to reach more of these children and families in rural areas. But, for all this to continue and expand, we need to own our own land and buildings. We are working to get grants, donations, matching funds, and other means of support to raise the money needed to take AHOPE to the next level. We're innovative and we're flexible, but we're also diligent, optimistic, and caring. Every day, we work with children who have a life-threatening disease, who have had significant trauma in their lives, who face continued discrimination from the stigma of HIV/AIDS, and who themselves are constantly changing. We work with makeshift families that have often come together in different ways and are trying to get by under difficult conditions while caring for these children. There are an infinite number of situations and circumstances that we incorporate in our work on a daily basis. We have a proven track record of success in caring and nurturing HIV-positive orphans, and we're the only privately funded organization in Ethiopia to exclusively care for these children. We're successful because our first mission is providing a safe, helpful future for these children based on proven principles and looking forward to each individual child's future. The dedicated staff and volunteers at AHOPE are nothing if not resourceful. First of all, we rely solely on donations to make it possible to care for all these children and families. So you have to take a broad, innovative, and comprehensive approach to finding and raising these funds. We're relentless in our pursuit to tell people about AHOPE and the life-saving work we're doing. But because we rely on the good hearts of people to support us, every dollar is used effectively to serve the pressing needs of our children. Our U.S. operation is totally volunteer-based, so we send every dollar we raise to Ethiopia to fund our programs. Every member of our staff interacts directly with the children and knows them well. This allows us a day-to-day approach to meeting their needs in the most cost-effective manner. We are effective in our services that are measured every day in the health, education, and well-being of our kids. We certainly have the basic metrics of a successful organization. We go through a strategic planning process, identify goals and objectives, set benchmarks, and review our progress. Do people know about AHOPE? Do they go to our website, get our newsletter, or like us on Facebook? Are we meeting our monthly fundraising goals so that we have the appropriate amount of money to operate? The real measure of success and positive growth can be seen in the children. Do the children have what they need to get a good education? Are they doing well in school? Have they received good medical care? Are they well nourished and as healthy as possible? Are they happy and confident? Do they feel loved? And are our families coping with their circumstances? These are the outcomes that we use to know that we are on the right track and making progress. AHOPE for Children is the U.S. counterpart to AHOPE Ethiopia. We are all on the same team, but sometimes the two different names lead people to think we are not connected. Some people think that we're an adoption agency, but we're not. However, our kids are available for adoption, and we work through licensed and certified adoption agencies. We're always thrilled when one of our kids finds a family able to care for them. We feed, clothe, educate, care for, and keep healthy over 250 HIV positive children every day. One of AHOPE's major accomplishments has been and continues to be our ability to adapt and change over the years. Starting out as a small home to care for dying children and evolving into a place of life and hope for the orphans who live in our home is a major accomplishment. Expanding the program by starting a child development center where at-risk children from the community come every day for care and support was also a huge accomplishment. But we didn't stop there. We added to our scope by reaching out to at-risk children and families who live outside the city, providing home-based care. And we're innovating again by establishing a youth transition home for teenagers to prepare them for adulthood. The changing needs and requirements of the Ethiopian government, adoption agencies, individual donors, nonprofit donors, the medical community, social workers, and broken and hurting HIV positive children and families are just a few of the challenges that we face every day. Our biggest vulnerability is funding. Inflation in Ethiopia grows monumentally on an unpredictable basis. While we have the staff and volunteers to handle all the obstacles we encounter, the moving target is funds we need to survive. We're not working with men and women who can learn a trade or start a microfinance program to earn income. These are children. It's compassion and goodwill of others that keep us going, and in difficult economic times, we are very vulnerable. Additional resources would make a world of a difference. We need a sewing room and sewing machines to help the children, especially the girls, learn a trade while making garments they can be proud of. We need books and tables and carpet for our community library. We want to build an arts and music room. We have volunteers to teach children music, but we need instruments. And we have artists to help the children express themselves through art, but we need easels and art supplies. All of this will have to wait until we secure funds for the basics, such as a new refrigerator and freezer. And really, all of this comes after tuition, books, and other funds for school supplies. A solid education is essential for these children, and it's a top priority that they all attend school. So if we have significant additional resources, we can help many more at-risk HIV positive children and families. AHOPE is a fairly comprehensive organization, as is the support we provide. The gaps we could fill are gaps in quantity. There are thousands of HIV positive orphans that are destitute. They are in compromising living situations or are living on the streets. We have the programs to help pull them into our care, but it's the funding that will allow us to increase our capacity to reach these at-risk and vulnerable children. We certainly hope that anyone hearing this message will join us in making a difference in the lives of these beautiful children.